Dr. P, I'm so excited to be sitting here with you. Thank you for making this happen.
First of all, thanks for the invitation, and I love what you're doing with holistic health.
When you're creating a skincare product, what is the first step? And I also want to help the people who are listening know what to look for. Even as we're talking about this, I'm like laughing at myself for even asking the question because this is what I believe in the most.
I would really break it down into 5 steps.
If I could just use all natural things all the time, I would definitely prefer it. I want to go to the lotus plant and take this seed and rub it on my face.
Natural extracts are really good, but it's really important to understand the composition of the natural extract and what you're going after.
So vitamin C is better in water, right?
Let's talk about vitamin C because as I've mentioned, there are at least 10 different kinds of vitamin C.
Dr. P, I'm so excited to be sitting here with you. Thank you for making this happen. I know you have a busy schedule. I feel like this conversation is going to be really interesting because I'm a science nerd as well. I feel like I have a pharmacy background, and so given that, I am always wanting to ask questions like, what's the mechanism of action? What's the half-life? How is the absorption? And I just feel like you're the perfect person to ask these questions to. So I'm excited for this interview. And before we get started, if you could just tell everyone a little bit about your background and what you're doing currently.
Sure, thank you. First of all, thanks for the invitation, and I love what you're doing with holistic health, and I've followed some of your work. So again, I actually, let's start right from the beginning. So I grew up in India. I came to this country 26 years ago to go to grad school, and then I got my PhD in polymer chemistry. And actually, I didn't go to school to do skincare. My research was in lithium batteries and fuel cells, but at that time there was no industry on lithium batteries and fuel cells. So I ended up doing a postdoc, an industrial postdoc in oral care, and then from there moved on to skincare. And here I am 20 plus years later, doing research on skin science, skincare, on all aspects of it, on all different types of formulations, from color cosmetic, makeup, obviously skincare, cleansers and sunscreens. And I have held a wide variety of roles, from research and discovery to formulation to working with a team of skin biologists and clinical researchers. My current role, I am the Vice President of Skincare R&D at Allergan Aesthetics, which is part of AbbVie. And I'm fortunate to be working with a team of really talented scientists with very, very diverse backgrounds. So they're really experts in molecular biology and cell biology, epigenetics, aging. Some of them have degrees in chemical engineering and material science, and some of them are PharmDs, right? So,
yes.
So all together we are working on doing research and creating the innovation pipeline for Skin Medica and Diamond Glow line of products. And so I love this industry, and over the last 25 years, I've been fortunate to be associated with many cool research and innovation, and fortunate to be part of named inventor in 80 plus patents. And my passion is really, how do you turn invention into innovation to serve some of the unmet needs of consumers and patients through evidence-based skincare?
I'm curious about your background. So I feel that there is a connection between engineering and what you're doing, but I also feel that for someone who doesn't know or is unfamiliar, that might seem very out of left field, but there is, right? Because you even said some of the people on the team do have an engineering background.
Absolutely. So people, and we'll talk about the life cycle of formulation development, right? So let's start with the engineers. So they're really chemical engineers who are responsible for what we do in a lab setting, in a beaker, making sure the same properties are maintained when it is scaled up in thousands of kilos, and that's the role of the engineer. And I'll walk you through kind of our innovation process and where kind of different disciplines and different scientists come in, and hopefully at some point we'll have you in the lab as well.
I definitely want a lab tour. I know we were supposed to make that happen this week, but I would love to see. I've always been so fascinated by the minute details. I think I'm a very technical person. So when I wanted to do this interview, I want to understand really how it works. When you're creating a skincare product, what is the first step? Because I just think so many products that come out right now are influencer-based, celebrity-based, which I'm not saying they're all not good, but I know for a fact that a majority of them are white labeled. They're going to the same labs and just picking, like, I want vitamin C, I want vitamin A, I want something for brightening, whatever, and they're putting a different label on it. But the actual lab that's doing the innovation, the creating, that's really what I want to get into in this interview. And I also want to help the people who are listening know what to look for, because I think that there's so much marketing and you can waste a lot of money. You can get products that don't work, and I think we can teach them, like, hey, here's the things you want to look for when you're getting a vitamin C. So let's just start with maybe the basics of how is the lab run? Like, how are you guys, how much time is spent innovating on a product and researching versus actually making it and testing it? Just give us a little overview.
Yeah, absolutely. And you hit the nail in the head. Like, even with 20 years of research, when I walk into a store, I am overwhelmed with the number of products. They all sound similar. They all have vitamin C or peptides or retinol, right? And the claim sounds really similar. So maybe let me walk you through the process of how we develop products and evidence-based formulation science, right? So I would really break it down into 5 steps. So the first step is really understanding the key unmet need. What are we trying to solve? Are we going after pigmentation concerns? Are we going after hydration or acne? And from there, really understanding who's your target consumer, what age group are we looking at, and what geographical location, because we know the effect of environmental factors, right, that comes in. So really making that absolutely clear of what exactly is the skin concern we are going after. The second step is, based on that, understanding the underlying biology of that skin. So are we targeting skin of facial skin or skin around the eyes, or are we talking about neck skin? And we'll get into more details around that.
I want to get into a lot of details on that.
And then let's take pigmentation as a concern. So this is where our biologists and pigmentation scientists come in, and they really try to understand the life cycle of melanin formation. So we call it melanin life cycle. And then from there, really understanding what are the areas we want to cause some intervention to reduce the unwanted pigmentation. So the second step is really, I would say, target identification. The third step is ingredient pre-screening. So once you identified the target, there are many ingredients, and we go through sort of skin in vitro models to pre-screen some of these ingredients for each of those target pathways. The fourth step, this is where the formulation science comes in. And this is where we start to combine those key ingredients targeting different pathways together. And this is, again, extremely important to have the right delivery system or the base formulation. Because once you start combining ingredients, we have seen in many cases, they actually cancel out each other because they are no longer effective for a variety of reasons. Could be their physical interaction, could be a biological interaction. So in our formulation development, we go through hundreds of prototypes to get to that lead formulation. And the last step is creating the evidence and doing the clinical studies and ensuring that we are doing the clinical studies in a diverse group of patients to make sure all their concerns are addressed. And I can get into more details on how evidence is generated, but that kind of is the whole process. And throughout our research, we have found, again, if you combine ingredients, 2 ingredients, 1 + 1 you'll be lucky. It's never 2, right? So In most cases, it is 0.8. You'll be lucky if it's like 1.2. And that's why the combination of ingredients, because they each have different properties and different benefits.
They dilute each other, or they're actually canceling each other's effects?
There are two effects. One could be a physical interaction. So one ingredient may work efficiently at, let's say, a certain pH or a certain condition. The other ingredient may not, right? So the physical interaction kind of cancels it out. The second could be a biological interaction. They're targeting things that one may be upregulating, the other may be downregulating, right? So they're canceling at a biological level.
Right, like vitamin C might do A, and vitamin A might do B, but vitamin C might reduce B as a side effect.
Absolutely.
So they might be canceling each other out.
Yeah.
Okay, that's interesting.
And in our research, we have found that when things are you're not getting the expected efficacy, we tend to add more ingredients, and sometimes less is more. We have seen that removing certain ingredients actually helps with the efficacy. And the analogy I would like to use here is, let's say you have like really talented musicians, right? And you bring them on stage and you say, okay, why don't you do a concert? And they haven't practiced, they're just playing, the best they can. But as opposed to a really perfected, optimized symphony, right? So it's really the balance and optimal balance of ingredients that brings the best. And that's why it takes time, and it's not just throwing known ingredients together to get to the efficacy.
That's a beautiful analogy. I always love analogies. I feel like it just really ties it together. And you really just hit the nail on the head, because I think that I used to think this way with food. I'm just going to add a bunch of things and like the most amount of superfoods, and it makes it healthy. And I also think when people see, like, let's say a green drink that has all these different vitamins and things, or they see a product that has everything in it, sounds like less is more. Is even if you had to just pick a safe rule, it might be the better way to go, unless you know it's really good.
Yeah, no, absolutely. And again, staying with the food analogy, let's say you're at this, chef's competition. So each person is giving 5 ingredients, but they all come up with very different flavors, right? Mm-hmm. It's kind of similar to that. So, so once you do this iterative process, you really understand the optimal level. So it's, again, not about the concentration of the ingredients, because we have found that at higher concentration in 2 different bases work very differently. In a optimal formulation or base, a lower concentration may work better, right? So I think the taking really time to
huge.
Optimize the.
That's huge, because like a lower concentration might actually give you more effect.
Absolutely.
It doesn't mean higher concentration, higher effect.
Yeah.
So when since you have your own lab, so is there ever a time that you would create a product where you're like, we know, for example, CE ferulic, I don't know if people here know, it's a very common combination. It's kind of a hero product. I forgot the brand, is it SkinCeuticals? But you know that those 3 work well together. So would you ever create a product where you already know the synergy, or are you always doing your own testing to make sure?
So let's take the example of vitamin C, mm-hmm. right? So there are actually 10 different kinds of vitamin C. So it's pure vitamin C, which is ascorbic acid, but there are many different derivatives of vitamin C, and people have done that as part of the innovation because pure vitamin C is not very stable. It only works in certain pH, and there are other forms of vitamin C that may be more stable, but there are always trade-offs. So, and then you bring in the complexity of the base formulation. Is it a serum? Is it a water-based emulsion, or is it an oil, right? So that with that complexity, it's almost like starting from scratch. Mm-hmm. Yes, you know the basic properties of each ingredient, but once you introduce the base and once the combinations, everything is you can't rely on anything. So that's why that stepwise formulation approach is really, really important.
I just really hope everyone's soaking this in, because this is why not all products are created equal. That's why when something is cheaper, it's not always going to be the same just because the ingredients say the same. Are you looking at the form of vitamin C it is? Are you looking at the concentrations, what the carrier is, whether it's a serum or an oil or water? So much of this is important. And I'm so glad we're bringing this up.
Yeah. And then one more example on vitamin C, and again, pure vitamin C, L-ascorbic acid. The other important aspect is the pH of the formulation, right? So vitamin C is water soluble. However, the skin absorption is optimal at a lower pH, right? So as you start layering products, that may affect the skin pH. So pH is another important consideration as you are formulating different types of products and really understanding, we call it structure property relationship of the ingredients. So ingredient has a certain structure, but really understanding the boundary conditions of those and where it will work in an optimal manner.
So the structure, the boundary conditions is like what it binds to around it? Like receptor sites?
The boundary condition from a physical chemistry point of view is what are the pH ranges, it is most stable. For example, retinol is oil soluble. However, if you create a formulation of retinol at a lower pH, it will be unstable. So understanding those conditions are really important when you're actually combining different ingredients with different properties together.
So I'm assuming there's a lot that these chemists in the lab already know, but is this when, like, let's say they're like, okay, we want to make a retinol product. Are they putting it under the, I just want to know, I'm trying to understand, putting it under the microscope and actually looking in and seeing, is it stable or not at this pH, or is it stable at this pH, or letting it sit for a few days? How does that work?
Yeah, so there are different studies and testing. So we talked about the different steps. And there are different criteria. So first criteria is kind of efficacy. The purpose, the reason you're adding the ingredient, let's say retinol to target collagen or elastin, making sure that property is maintained when you're formulating with other products and other ways. So there are many skin in vitro models that can be used as to provide guidance on the efficacy parameters. So that's one aspect of it. The second aspect, exactly what you said, is we run stability studies in the lab at over months and 3 months at elevated temperature to really stress the formulation to test the robustness. Because when you make it at room temperature, and when it's sitting on the shelf, it may behave completely differently. And then the third aspect of is when you go from a 1 kilogram formulation to thousands of kilo, what are the changes happening? So we are looking at all these different aspects, both from efficacy, stability, as well as skin safety considerations.
So just because you apply a serum and it feels nice on your face doesn't mean it's actually effective or that it's doing what it's supposed to. I don't think people can rely on texture. And I think that's where a lot of consumers go by. It's like, oh my God, it feels so nice, but that could just be a product that just, right?
Absolutely, yeah. And also, let's say peptides, right? Peptide is a common class of common ingredients that are a sequence of amino acids, but not all peptides are equal, right? So because they all may have different chain lengths, there are tetrapeptides, pentapeptide, hexa, and larger molecular weights. So their effectiveness in a base formulation is totally different. Their absorption in the skin and their ability to activate different purpose and function is totally different. And yes, to your point, just because it feels great, in fact, we've done studies in our lab where we take a set of active ingredient, let's say A, B, and C, and we test in different kind of base formulations. So let's say a oil-based or water-based or this, and they perform completely different, completely. Wow. So that's to your point, yeah. Just because it feels great and just because it has a peptide doesn't mean, so that's why you want to look for the level of evidence and ask the right questions.
I'm curious, so I love learning this too because I also think it makes consumers really appreciate a product more that has had this much time that go into it. It reminds me of when I learned how movies are made and how, writing the script, getting it sold, getting let's say a network or production company to make it, and then making the movie and then getting it to the film festival and then it bombs and then no one sees it, or it does make it to the theater and people are like, okay, that movie sucked. Like there's so much time and years that went into that, and I think it's good to just have that consciousness and awareness to appreciate all the work that goes into it. So I'm just curious how many years it takes to create a product at this level of attention to detail.
So from really start to finish, I would say it can take up to 3 to 4 years, right? So when you're trying to study the fundamentals of biology, when you're trying to come up with and understand a new pathway that didn't exist before, when you're trying to discover a new molecule that targets that pathway, it can take that amount of time. Again, this is not the norm. You can pretty much launch products in 9 months, right?
Yeah, because the lab already has a few formulations,
Right.
just slap a sticker on it and brand
Absolutely.
it.
And
Right.
then comes all the testing. I think when we test our products, ensuring we are testing in a diverse population, right? So, and we'll go into the level of evidence. I want to share with you like how we view kind of the different types of evidence that is commonly generated.
You can share it now. I'm curious. Go ahead.
Yeah, so we think about evidence, think about it as a pyramid, right? So base of the pyramid is the most common type of evidence that is currently generated in skincare industry, and it's at the base of the pyramid is also the easiest, right? So most claims, a number of claims are made based on ingredients, which means this ingredient has been tested somewhere to do X, Y, and Z, right? That ingredient alone, and that's why these are called ingredient-based claim. They're not tested in this final formulation.
Ingredient-based claims. So I think a lot of the celebrity or influencer brand products that are like clinically tested, they're not doing the clinical testing, but they know the product has been clinically tested, so they can say that.
So we'll get into the clinical.
Got it.
We'll get into but ingredient-based claim is how we are using vitamin C, which is known as a great antioxidant, or it produces collagen or elastin.
Right,
things
ingredient-based
like
claims.
Right?
You're right, I apologize. Okay.
The second level is in vitro skin testing, right? So we have in vitro models, and you can test your ingredients in a formulation, and you show the upregulation of collagen or elastin. The third level, I would say, is the clinical testing, and then there are different layers in the types of clinical testing. The easiest and the most common is more subjective. I would say these are consumer perception times. That means consumer perception type claims. That means you use the product and then you answer a questionnaire and say, hey, this product helps improve my skin texture. So it's very subjective. It's important, but I wouldn't rely just on that, right? Then there's also before or after pictures. You see a lot of before and after images where it's really important to understand the standardized photography is really, really important. A lot of times you see before and after, and the hair color is totally different because the lighting may be different, right?
Yep.
Above that, which is what we call as controlled clinical studies, and these are IRB approved. These would be double-blind, placebo-controlled studies, and these are really hard to see benefits and results, because also in skincare, a number of the emollients actually provide some skin texture benefit. To really show the benefit of your active ingredient, you should be doing those placebo-controlled or vehicle-controlled studies, right? So that's the next level, and within that, you can do objective clinical measurements. So there are two ways to do objective clinical measurements. One is through instrumentation. So you're actually measuring what's your, through an instrument, your transepidermal water loss or skin elasticity with an instrument.
So you can test that physically?
You can test it, you can measure it. It is very, very objective, and you can do statistical significance and all of that.
That's cool.
And then there's also expert grading. So these experts could be dermatologists. They are trained in a grading scale, and they are assessing a change and progress in your in the efficacy or the use of the products.
So how can you tell if something has had like that level of testing? Is there a way to look that up on, and what would the words be on the packaging?
So I think this is where we need to kind of train our consumers as well as doctors on asking the right questions. Hey, there is consumer perception data, which is great. Do you have any instrumental measures? Right?
Instrumental measures.
Instrumental measures. Is this expert graded? Is this a vehicle controlled or placebo controlled studies, right? Mm-hmm. And you can even, what we do, we kind of raise the bar. We often test against the highest bar. We test against RX products. So I'll share some links for your listeners and viewers where we have tested acne product against a RX acne product. We test retinol product against a retinoic acid, which is an RX product. And then, there are also, we want to make sure we are testing the products in the right conditions against in unfavorable conditions. By that, I mean, we know that pigmentation, if you're doing a pigmentation study, pigmentation tends to improve from fall to winter. So if you start your study in fall and in winter, you will see an improvement in your pigmentation measures, right? However, the right way to do the study is the middle of summer, right, where you're exposed to pigment. And so we often push the limits, and we want to make sure we do the studies in these unfavorable conditions. We have also done studies in the most polluted cities in the world, right? So we have done, if we want to test the effect of antioxidant, we have done studies in one of the most polluted cities where the air quality index was like really through the roof, in Beijing and New Delhi, and we have shown the improvement. So those are kind of the different levels of evidence. Yes. And to your point, yes, I think it's more about asking the right questions, looking at peer-reviewed publications, and so.
This is a note for social. We need to do a video that's like the 4 things to look for when you're researching a product, and we'll just pop these up with the check marks. I think that's really great.
Yeah.
God, that's so, the unfavorable conditions make so much sense because, of course, like melasma is going to get worse in the summer.
Yeah.
We were just talking about the dermatologist I see in LA, who's Dr. Pearl Grimes, really an expert in this field. And even the things you were saying, every time she takes a photo, she has a professional camera. It's the exact same setting. I've gone to dermatologists where they come over with this iPad and they'll just, different rooms, even I'm like, you guys, when they try to show me before and after, my skin color looks completely different in these two. So you really have to make sure, if you want to go there, if you're really looking for a product to improve something like significant, clinically improve something, you have to make sure you're taking these measures, or you're just going to be wasting your time and money, right?
Yeah, no, absolutely. Again, we just don't want to launch just another product, right? So, for example, we have been researching pigmentation science for over 10 years, right? And we take, what are the need gaps that our product is serving and where the gaps are. And we want to make sure when we launch something, we are elevating that standard of care and that the patients are really seeing a benefit, and based on the current science. And the science keeps evolving, and that's when we feel like, okay, we may want to try a new pathway, right? And that's what we did with one of our recent launches. And I can tell you the story about how we discovered that product.
I'm curious, when the science evolves, like what are you discovering and then how are you adjusting? Are you seeing that 2 new ingredients, oh wait, these actually are more stable together, so let's make a new formulation?
Yeah, no, that's a really good question. So again, when we think about new innovation, and we spend a lot of time thinking about it, it's really few things trigger like why we would create a new product. The first one is unmet need or underserved need. So for example, things like acne, pigmentation concerns, they have existed for years. However, patients are still, or consumers are still not satisfied, right? So from there, we look at, is there new development in pigmentation science and biology that is happening in the academia? And when we found that there's a new development in a new target pathway, that's when we said, can we build this in our new product formulation?
Can I just, I want everyone to understand, me and you, I'm like, right, target pathway,
Yeah.
but maybe for people who don't understand, it's really hitting a different receptor site in the body.
Absolutely, yes. So again, let's stay with the theme of pigmentation. We studied what we call as the melanin life cycle, the life cycle through which unwanted pigmentation occurs, right? So there are 4, 5, or 6 different pathways. And recently we discovered melanosome degradation as a new pathway to remove unwanted pigmentation.
Oh, wow.
And once we identified that pathway, we said we used actually computer modeling and simulation to identify many molecules that target that. Once we found the right molecule, we actually turned to nature to see which plant or which extract is enriched in this phytochemical. And we found that lotus extract is enriched in this specific phytochemical. And then we go one step further. It's not just any lotus extract from any part of the plant. It is from a very specific, from lotus seed. And it's a very specific stage of development during sprouting stage.
Wow.
That's when the phytochemical is most enriched.
Wait, that's, first of all, just because I love sprouts and I talk about them all the time, that's why I always say a sprout has all the nutrients. That's why they're so good for you. So when it's sprouted, that's when it's the most strong in this phytochemical.
That's when we tested all parts of the plant and we found during the sprouting stage, this phytochemical is most enriched. So we capture that, we extract that, enrich that, and we formulate in a product. And again, it's all about testing for final formulation. So we test it in the final formulation to ensure that that specific target pathway is still valid and it's still working. So that's an example of how innovation would come about in solving some of the key unmet needs.
That's so cool. I just have to keep going on this because now I'm curious. So for the people who love to go natural, like if I could just use all natural things all the time, I would definitely prefer it. Like I want to go to the lotus plant and take this seed and rub it on my face. But is there always, like when you're extracting it, how many do you have to get to actually get that concentration? Is there a way to do it a little more holistically without adding in the pharmaceuticals? Or is that for stability or is it for potency?
So
does that make sense?
Yeah.
Okay.
So you're saying, like, why do we need other ingredients? Or
I'm curious, like, can you just go to the lotus plants? I feel like this might even be, you can tell me this is a question that doesn't relate to you, but I feel like there'd be like herbologists or people who would just take the lotus plant and make a little tincture at home. But what happens in the lab to make it so, it's almost like if you're extracting a protein.
I think it's so natural extracts are really good, but it's really important to understand the composition of the natural extract and what you're going after, right? So sometimes in this case, we standardized and enriched the phytochemical we were going after because sometimes natural extracts may also have other ingredients that may cause sensitization to your skin. So I think it is more about testing and ensuring that what you're after, you're getting that. So and also testing the safety aspects of those natural extracts.
It also makes sense too because we're talking about one specific part of this plant.
Right.
Whereas you can't it's really hard to get that one specific part. If you're just like, let's say, eating the plant or putting the plant on your body, you're not going to get it in such a concentrated form.
Right, absolutely.
So that makes sense too. There are so many questions I have, just technical questions. So this isn't going to be rapid fire, but almost just going through different things like that I think could really help people.
Sure.
One thing that I just recently learned about, I'm very curious about serums in general. First of all, I've always, to my understanding, a serum is more, the molecular weight is smaller so that it gets absorbed into your skin more. Correct me if I'm wrong, which is why they're more expensive and why they're more potent. So is that accurate?
So let's talk about serums.
Okay.
And
maybe I'm wrong.
I think if you take a poll with all of the cosmetic chemists or people out there, okay, what is a serum? So the definition they would come up with is as follows. So number one, it has to be fast absorbing, right? It is treating and targeting and correcting a certain skin concern, and it needs to have, I won't say a high concentration of ingredients, an optimal concentration of ingredients to target a certain skin concern, right? So, and it needs to be absorbed really fast. So the viscosity, so you talked about molecular weight, so I would refer to that as it is, fluid, easily absorbed, and traditionally lower viscosity, but also the delivery system of that is optimized for the ingredient you're trying to deliver to target a certain, to correct a certain skin concern.
So now compare that to how you would define a moisturizer.
So moisturizers are traditionally would be more thicker in consistency or viscosity. And again, within moisturizers, they can be light moisturizers, medium and thicker. And they usually contain high levels of lipids and ceramides. And the purpose of moisturizer is to improve skin barrier function, which means the functioning of the top layer of the skin, which we call as epidermis, and to reduce the transepidermal water loss. So what that means is reducing the evaporation of the water from the epidermis. So that's the definition of a moisturizer. And I'll take one step further and talk about a hydrator. So hydrator is one that improves the humectants in your epidermis, right? So over a period of time, as you use a hydrator, it strengthens the barrier function, but also improves the humectants such as hyaluronic acid and other proteoglycans that are, again, basically humectants. They increase the reservoir of and the retention of the water. So it's more holistic and it's better for longer term use. So those are kind of the difference between a serum, a moisturizer, and a hydrator.
Does a hydrator look the same as a moisturizer? Does it have the same consistency? Or I don't think I've ever actually seen a hydrator.
So a hydrator can have a consistency, I would say, between serum and a light moisturizer, right?
Okay.
But the key, more important, is what it is doing. So the key definition of a hydrator is upregulating and improving the levels of endogenous biohumectants, so your skin and epidermis is actually getting healthier over time. So improving the reservoir of your epidermis.
So it's actually upregulating things versus moisturizer, which is just preventing water loss.
Absolutely.
Okay.
Yeah,
so serum is more functional because there will be some moisturizers that are like brightening moisturizer or like retinol moisturizer, so they do seem active.
Yeah.
But it's just things added into it, whereas technically a moisturizer does that make sense?
Yeah. So
is that marketing?
Okay, so let me answer that. Yeah, so there is no, I wouldn't say there is like a technical definition of a, so you can call a slightly heavier serum a light moisturizer. So the line starts blurring, right? So, and you can call a light moisturizer a serum, and then somewhere in between there's lotion, right? So,
so that makes sense.
So there is no, I wouldn't say a really, really hard technical definition. It is, but if you tell me, hey, I want to create a serum, I would start with a lower viscosity, faster absorption, versus you say, hey, I want to formulate a moisturizer, then I would ask the question, do you want a light moisturizer or a heavy moisturizer? And what other benefits you would like to see? And to your point, you say, I want to see pigmentation benefits and I want a light moisturizer. And then it's really up to you, like what you want to call it.
Okay.
But it's more about the purpose it is solving. But so the two extremes are moisturizer is reducing the transepidermal water loss.
Yep.
And then a serum is correcting something. And now there are also hair serums, right? So which is, again, playing on maybe the fluid and the consistency and the low viscosity, and it probably has some benefit providing ingredients.
That makes sense. And the reason I'm getting so technical with this is because serums are so much more expensive. So I just want to make sure when someone listening to this goes out to buy a serum, can they be tricked by a company with the marketing if it's called a serum where it's really not that active? But I guess really the definition is just in the viscosity and then in the function.
And the skin absorption and the feel. And again, I would go back to our evidence matrix or evidence pyramid. So whether it's called a serum or a moisturizer, before you buy, like checking what are you buying it for, what purpose, right? So is it to address your pigmentation, and what kind of evidence they have to rather than just because it's a serum, it's going to be effective.
Exactly. So I'd almost say I wouldn't buy a hydrating serum. I would only buy a functional serum for dark spots, for pigment, for fine lines, whatever it is, and then buy a hydrating moisturizer because you'll probably save money that way.
Yeah, so it's, I would say, customized to your individual needs, right? And what your skin concerns are. This is where you want to talk to a dermatologist and get some advice and talk to some experts.
Of course, okay. I want to understand also with serums, there's water-based, there's oil-based. I've learned that, I've read somewhere, I don't know if this is right, that in the US maybe 70%, they dilute serums with like 70% water, whereas in Europe they're more concentrated. Have you heard anything about this?
So I would again, as a scientist and technical person, I would see this as water-based and oil-based as delivery systems, right? And what exactly are you trying to deliver? So if you want to formulate ingredients that are water-based and oil-based together, you want to look for, a serum that can accommodate water-soluble ingredients like vitamin C and peptides and niacinamide, and oil-soluble ingredients such as ceramides or retinol, right? As opposed to if you want to deliver only oil-soluble and lipid-soluble ingredients, you may look for a oil-based. And there are pros and cons to both. For a oil-based, you want to make sure, your skin is not acne prone, and making sure the product is tested for non-comedogenicity, right? So meaning it doesn't clog your pores. So that's how I would view it. So it's not one is better than other. It is really what exactly you're trying to deliver, what combination of ingredients.
So there are certain ingredients that you are just going to be more effective water-based versus other ones that are going to be more effective oil-based.
Absolutely. So if you want a certain combination of ingredients, like for example, pure white, let's say niacinamide. Let's say niacinamide is water soluble.
Which is used for what? Niacinamide. What is it usually used for?
Niacinamide it's actually a very, very well known ingredient, and it has properties in skin barrier and skin barrier function. It also has some benefits in pigmentation.
Okay.
Right? So.
Okay.
Yeah.
So yes, it's better in water or oil. What does it have?
So niacinamide, if it's water soluble, it will be ineffective in an oil phase. So again, it's really understanding. I would start with what benefit you're trying to achieve, what are the different ingredients that we want to formulate and optimize, and then go from there.
So vitamin C is better in water, right?
Vitamin C,
does
again,
it depend?
Yeah, it depends because we are vitamin C. Let's talk about vitamin C because as I mentioned, there are at least 10 different kinds of vitamin C. So
is there one best one that should always be in skincare? For example, are the ones that are worse just cheaper routes to go? And is there if you always want to stick to this one if you can?
So pure vitamin, and there are always trade-offs. The reason there are 10 different kinds of vitamin C is there are trade-offs with pure vitamin C. It is very effective as an antioxidant, but it is extremely hard to stabilize, right?
Okay.
So that's why your vitamin C serum sometimes turns colored, right? And also vitamin C needs to be formulated at a certain pH. So over time, people have come up with different derivatives of vitamin C, and so that's why not all vitamin Cs are created equal. So when you see a vitamin C claim, you want to look for what kind of vitamin C there is and we've tested different vitamin C products, and they're not all equal, right? So they actually give different properties. So it's not a simple answer, unfortunately. It is a complex science. It is, a lot of different products, vitamin C products together.
Okay.
Yeah.
Is vitamin C always something, should you always look for it in a tinted bottle? Should it always be kept away from the sun, or depends on the form of vitamin C?
I would say it depends on the form of vitamin C. So there are oil-soluble vitamin C that are more stable, that are more lipid-soluble, which means it's easier to get absorbed in the skin. However, it needs to get converted. It's like a pro vitamin C. It needs to be converted to vitamin C to be effective, right? So it's that fine balance of ingredients to achieve. So, you can use the right combination of vitamin C to achieve the optimal benefit. But I don't think there is like a formula that this form of vitamin C is the best. It's, again, what's your formulation base? What other ingredients do you have in there?
Yep.
It's water based. What's the pH of it? And so, unfortunately, it's not a straightforward answer.
It makes sense, and sometimes I want like a straight black and white answer, and I'm sure people just want rules. But the truth is, there's so much gray area, and sometimes we do just have to put in a little bit of extra work. You want people to just tell you, okay, this is good for X, Y, Z, and take this for this.
Right.
But I think one thing I'm really getting out of this conversation is research the brand that you're going to buy. Look at their clinical data. Go to their website. They probably have an FAQ or an about, and if there's not much listed, I would probably personally not trust it, because I feel that brands that have done the work would share it and would be willing to share it.
Absolutely. And one more way of measuring the level of evidence is publications. So look for those peer-reviewed publications. It can be on their website, or ask for that. So, and for your viewers, we're going to reference some of the publications on retinol we talked about.
We'll put some links.
Yeah.
And I think publications can seem intimidating to some people,
Yeah.
but just go to the conclusion. If anything, go to the abstract and then go to the conclusion. If you don't want to read all of the middle, this is not really your expertise, it's still good just to see if that's even there. There's a lot of brands that won't even mention this and just throw in some terms about marketing. Okay, so we covered serum and moisturizer. I also am very curious about eye creams and neck creams, your décolletage, your eyes, because these tend to be more expensive. I want to know how a consumer can know if they're getting ripped off, or if it is actually, because can they make any moisturizer and just call it a neck cream and charge more, or call it an eye cream?
So again, let's start with the basics, right? So let's talk about the biology around the eye skin, right? So it's really understanding the eye skin is, the skin around the eyes, periorbital skin, is very different from facial skin. It's significantly thinner, and that's why it's prone to both significantly more for intrinsic aging as well as extrinsic aging. And that's where you see symptoms like dark circles and fine lines and wrinkles, and the first signs of aging actually start around the eyes, right? So when you're formulating a eye product, you need to ensure you are understanding, and we talked about the target pathways, right? So for eye cream, it is really important. Is it you're addressing pigmentation issues, you're addressing some of the collagen and elastin that over time has degraded in the dermis. You're addressing that. You're also addressing some of the hydration issues in the epidermis. And then for prevention, making sure that you have some antioxidants and anti-inflammatory agents. What is really important for eye cream is the safety, right? So making sure that the ingredients you use around the eyes are gentle and prevent the migration of the ingredients or the formulation in the eye. The pH of the formulation is really important, and also this is where the clinical testing, making sure that it works in diverse patient types, because because the etiology of aging for around the eye is different for different race and ethnicity. So with
Right.
all that consideration, right? So you need to create an eye product. You also need to ensure has robust microbial stability, right? So because contamination during usage can also lead to adverse events around the eye. So it's not. So evidence-based eye cream or formulation needs to address all of these target pathways and all these considerations for both efficacy as well as safety.
So should an eye cream have all of those active benefits per eye cream, or can one just cover dark circles and one can be for elasticity or collagen?
You can have all the combination of all those benefits formulated together.
Okay.
But again, it's not easy, and that's where you need to have an iterative process to make sure the ingredient you're adding for a particular purpose is maintaining the benefit in the final formulation.
Yep.
Right, so.
And I mean, your neck, I know, I always, women always say your neck goes first, and
Yeah.
it's an area if you don't take care of as much, this skin is also thinner.
Yeah.
So are you really just addressing like elasticity and, I mean, what, hydration,
Yeah.
collagen?
No, great question. And I would say neck skin biology is most complex because, to your point, it is thinner, but it's also prone to the different motions and everything. And with the looking at the phone and everything, it's also well known that the wrinkles in the neck skin are 5 times deeper than the wrinkles on the face. You can see my wrinkles here.
I have a line of mine. I've been there for a long time. And
Yeah.
everyone has one.
So to your point, neck cream have to be formulated differently. We're focusing more on the quality of the collagen, the quality of the elastin fibers, and also from protection point of view, having the right antioxidants, having ingredients that prevent the degradation of some of these essential proteins in the neck cream. So again, these are very specific formulation and addressing very, very specific needs for neck aging. And again, for your listeners, we'll provide a link on a peer-reviewed publication on neck aging as well as how to address through topical skincare.
Here's what I think I'll do in the show notes of this or in the YouTube description is the title of the study, like this ingredient has helped do this, and then link the study.
Yeah.
So it'll make it easier for people.
Yeah.
I know a lot of friends of mine and women I know who really like to spend a lot on skincare. They'll take an eye cream and put it all over their face because they're like, oh, this is the real stuff. So I'm going to use the really expensive stuff for all over my face or like all over my neck. Is that beneficial though? Or is it like actually we should target the eyes separately than the face?
So ideally, I would say you should target the eye separately for all the reasons
That we mentioned.
I mentioned, because it is specifically designed for, and on the face, you may actually want to use something more potent because your face skin can tolerate that.
Yep.
But eye cream may not be able to because it is so delicate and it's so delicately designed and formulated.
That makes so much sense. I do have one more question before I go because we're talking, I was going to keep going on this list, but so moisturizers or serums, active serums, I've always felt that you can't, once you start aging, you get certain wrinkles. Like you can't make a deep wrinkle go away unless you're getting Botox, like an actual line. But obviously you can help with fine lines and small things and texture. But if you're really moisturizing, like if someone's starting at 18 and just really like on their skincare, does it make a huge difference, the products you're using day in and day out? And is it just that you're locking in the moisture? Is it the dry skin that's causing these fine lines and wrinkles?
Great question. So I think let's again dive deeper into what causes wrinkles or what causes sagging of skin. So let's start with the biology of skin. So the top layer of the skin is, and I'm going to provide a simplified version. It's called epidermis. So that's important for the skin barrier function. That's where your moisturizers are going to be most effective. That's where some of the biohumectants we talked about, your hydrator is going to be most effective. And then the deeper layer of skin is called dermis. And there's a type of cell there called fibroblast cells. And fibroblast cells produce growth factors, collagen, other collagen, elastin, and other proteins. So the fibroblast cells are really important. That gives, think of it as the spring in your in the mattress, right? So that provides the structural integrity. So and then most of the aging we know is a result of extrinsic aging and as well as intrinsic aging that leads to degradation of some of the dermal fibril matrix, right? So if somebody is taking care of like from 18, they may not need to address anything in the dermis. So epidermal health is most important, and that may be good. But over time, at some point, right, and it also depends on the lifestyle, right? So over time, you may need some help depending on lifestyle and what else are you doing. This is where the epigenetics and the extrinsic aging comes in, right? So if you're using moisturizer and have a really bad lifestyle, right, that probably won't help.
Of course.
But over time, I think, to address the biology, you need to address things in the dermal matrix and the fibroblast cells and the growth factors and things like that.
I have two follow-up questions to
Yes.
that. One is about collagen. So with collagen trending so much over the last few years,
Yeah.
is it effective to apply collagen, or is it more effective to consume it? Or is it better to apply, for example, a zinc or vitamin C that's going to build collagen?
Great question. So let's talk about topical collagen. So collagen is a protein. It's a large molecule. So if you apply it topically, it's going to provide humectancy and hydration benefit on top of the skin. It is so large, it's not going to be absorbed in the skin to upregulate more collagen creation. So from that respect, you're better off using ingredients that have a higher chance of permeating through the skin and upregulating collagen and elastin. So these would be things like, could be vitamin C, retinol, growth factors. And then in terms of oral collagen, I wouldn't say I'm an expert in oral supplements and oral collagen. There are some papers that have shown may improve the hydration of the skin. But I would say it's really, topical skincare along with a balanced diet probably will provide more benefit. But I would love to hear your thoughts and comments on, collagen and holistic diet and.
I mean, holistic diet, I'm a huge fan of. Just clean eating is really my biggest passion. But collagen has always been one where I'm like, okay, I see some data that taking it's good in terms of at least joint health and bone health, but I was never really sure where it landed on skin. I figure I'd rather personally get it from a bone broth or a natural source. Once in a while, I will use like a collagen powder if I have to.
Right.
But I do prefer it natural if I can.
Yeah.
I'm curious too, in your research, is there any specific lifestyle modification that you've seen, like when combined with this skincare works the best, or is it sleep over diet, or stress, or is it just a combination of everything?
It's a great question, and I think it's a great topic that's being discussed on the effect of the longevity science and research on aging, and I think the research is clear on the impact of diet, sleep, and exercise together in aging and upregulating longevity genes. So skin being an organ, I would assume that all three of this together would have an effect on, and topical skincare, that's why we see this as part of this holistic health and providing that local hydration and nutrition in addition to your diet and sleep and exercise. So
exercise too for your skin, or just for longevity?
I would say more for your health benefits and metabolic health, right? So
it's all related.
It's all
I
related.
love
so
I'm
I
trying
don't
to pinpoint it. I agree.
Yeah. But I mean, you probably have seen, or I can provide anecdotal evidence, right? So when you follow really good diet and sleep and you're exercising, you're getting that natural glow, right? As opposed to staying up at night and partying till late, and that really has like effect, especially on my dark circles, and gets really bad. I think the other aspect of longevity, and this is related to sleep, is there's a lot of research on circadian rhythm, right? Mm-hmm. So there's research on how circadian rhythm based diet can be beneficial. There's a lot of work done by Dr. Sachin Panda at the Salk Institute, and they call it my circadian clock, so eating based on the circadian rhythm. What's really interesting, so every organ, every tissue, every gene expression in your body actually works based on circadian rhythm, right? And skin also works based on circadian rhythm. It does certain functions during the day, certain functions during the night. And again, that's why sleep is really important, but also having products usage at the right time during the day as well as the night. So night is more about repair and day is more about the protection. So
that's a good point.
Yeah. So
I know some people wonder if certain products matter at night versus the morning.
Yeah.
But there are things to target at night.
And again, we'll put a reference on circadian rhythm-based antioxidant and the research done there on how the different repair processes happen with certain ingredients at night versus during the day. So I would say, to answer your question, I think more research needs to be done to really pinpoint, but again, it is that holistic, right? Your lifestyle, which is diet and sleep and exercise and good skincare, evidence-based skincare.
Even as we're talking about this, I'm like laughing at myself for even asking the question, because this is what I believe in the most. It's like going for a 20-minute walk literally changes the way your brain, you can look at your brain waves and actually look at data, and it will change it. And it's known to reduce cortisol and relax you, and cortisol can cause acne and stress. And if you're walking in the morning and you're getting that morning sunlight, it's going to help set your circadian rhythm, and you're going to sleep better. And then you also, I feel like when I don't sleep enough, I just want to eat all day. It's like my body's searching for energy somewhere else. And when I sleep well, I just feel so much more balanced. So you're eating better, and then you're eating, foods that are more nourishing, and it's just this whole effect where like we are one. We can't separate our skin from our physical exercise and our muscles to our body. Everything's connected.
Yeah. No, I completely agree, and so it's more about this holistic balance with everything you do, and then getting some help from topical skincare, right? So it's not one or the other.
Exactly.
It is that holistic,
I'm going to get back technical a little bit, because this is one I've always been curious about, which is toners. So I feel like from the time I was in high school, it's been like, you need a toner to change the pH before you apply a moisturizer, and then I've learned, or after a cleanser, and then I've learned really a toner is just to keep your face dewy before you apply your serum so it absorbs more. And then you'll see some toners that are like witch hazel or salicylic acid, and some that are just rose water, and they're all called toners. So what's the deal with toners, and what do we need to know?
Great question. So again, I think let's start with maybe what are the kind of different regimen and steps of product application, right? So the first step before you apply anything should really be the cleansing step, right? So because if you're applying products on face that has dirt and other things, may lead to oxidative stress. So whether you're achieving through a gentle cleanser or toner, right? So you can.
I feel like everyone needs to wash their face.
Everyone needs to
wash. Guys, wash your face morning. Well, morning I don't use cleanser, but at night and I always have, I call it my white washcloth rule.
Yeah.
Where I will dab my face, and if there's a trace of makeup, I'm still cleansing. Like you have to get it all off.
Yeah.
Okay.
So I think that's the first step, and then toner, again, depending on what you're trying to solve. So the ones that have witch hazel extract, it's probably designed for some exfoliation. for better absorption of the product. For ones that have rose water, probably neutral pH, and
Rose water helps the pH?
Rose water may be neutral pH, so not changing the pH of your skin.
I see.
Versus witch hazel may shift the pH of the skin for better absorption of the product.
So is there one, should we be using a specific kind of toner to optimize skincare or optimize, let's say, the products that you guys create in the lab?
Toners, again, I think it's personal preference and on your skincare regimen. So I don't know you absolutely need toners, but if you like to use, I would say there's no harm on it, right?
Yep.
So, but I think again, so once you cleanse the sip, the first step should be using something that you're targeting for deeper layers of your skin, right? So dermis, and that's where a serum that's targeting the dermal health and the collagen and elastin comes in, followed by something that you need for your epidermal health, right? So, and which could be a moisturizer as well as a hydrator, and the last step in the process is obviously a sunscreen. So these are, I would say, the basics, and then you can add other things based on your needs.
That's like the basic place to start.
Yeah.
It's almost like you do your cleanse, it's just you need a blank canvas to work off of. You can do a toner next. I always like a little spritz. I think it helps my product go on. But this first product, the serum, it's almost like you're starting deep. So you got to start on the inside and work your way out.
Yeah.
And then when you apply your moisturizer, it's the outer layer of your skin.
Right.
And then every morning sunscreen.
Yeah, absolutely.
Okay, that makes sense. What are we going to get to? Okay, I do have a question on clinical testing.
Yeah.
So, what are the rules on this? I know we talked about all the different types of evidence, but with third-party testing versus doing your own clinical testing, you don't have to do third-party, but third-party is always the better one, right? Because it's a little more objective, or no?
I think it depends on the clinical design, right? Whether you do in-house or third-party, it is the combination of different types of evidence, right? So the subjective, the standardized photography, and the objective measure. You can achieve that with internal as well as third-party testing, right? So it's less about who's doing it, it's more about how you're designing it, and it's capturing those subjective as well as objective measures of testing. And also, I think what we truly believe in, testing in diverse patient or consumer population, right, with different race and ethnicities and different skin types and skin tones.
Okay.
Yeah.
This is just all so fascinating. I feel like this is such a great episode for people to really, really understand skincare. I think there's so much surface level things you can see on different videos or content or online, but I feel like we really got into the science of it. So thank you so much. Is there anything you guys are working on or any new research you're seeing that's really exciting or things that we can look out for? Or is there anything you'd want, as someone who's really in the lab and like forefront of research, is there something you wish consumers would know or something you want them to look for when they're looking for a product?
Yeah, so let me take a minute.
No problem. Take a minute.
I didn't think about this.
It can be like, even just like one tip. It doesn't have to be like the one thing you'd want them to know, but is it like checking to make sure they're actually doing the research like you guys do? Is it checking the stability to see if there's studies linked?
Yeah. Any?
I can totally ask a different question too, don't worry.
I mean, one thing I would say is things take time to work.
Yeah.
Don't work overnight.
Yeah.
Something that's important.
Okay, I like that. Okay.
Yep,
I
okay.
like
Do
that.
you want me to ask you again?
Sure.
I can frame it again.
Yeah.
So if there's one thing you'd want consumers to know that will help educate them when they're trying to buy new products, that will just help them in terms of getting the best quality, what would you say?
So we talked a lot about how we create this evidence-based formulation. So again, it's not about the ingredients or the individual ingredient. It is about the final formulation and making sure the purpose and the reason you're adding that ingredients, the benefits are maintained in the final formulation. So even, this is a message to all scientists out there that it takes time to really understand the interaction between different ingredients, to really study, to make sure you achieve that perfect balance on efficacy and stability, and also when you're scaling up, right, as you're going from 1 kilo to hundreds and thousands of kilos, making sure the product efficacy and the function of that ingredient is maintained and tested in that final formulation. And all of this takes a lot of time.
Takes a lot of time, and just like food, you don't absorb everything you eat. And just because they're putting all these ingredients in doesn't mean you're absorbing it.
Right.
So make sure you're doing the work and
Yeah.
the research. Thank you so much,
Great.
Dr. P. This was amazing, and I look forward to another conversation and coming to visit the lab.
Absolutely. Thank you. This is great.
Thank you.
Yeah.